1. During a TNCC course debrief, a senior nurse educator notices that several participants struggled to apply airway assessment protocols in a simulated trauma case. Which instructional approach best aligns with adult learning principles to address this gap? A. Provide a detailed lecture on airway anatomy and physiology. B. Assign independent reading on airway management techniques. C. Facilitate a guided discussion using the MIST scenario as a case study. D. Increase the number of written tests on airway management. 2. In designing a TNCC training module for rural emergency nurses, which method best supports adult learners' need for relevant, problem-centered learning? A. Using standardized trauma case studies from urban hospitals. B. Incorporating examples of injuries common in local farming accidents. C. Focusing on pediatric trauma exclusively. D. Reviewing only international trauma registry data. 3. A TNCC instructor observes a student performing a primary survey but skipping disability assessment. The most effective immediate feedback method for skill retention is 2. A. Correct the error after the session to avoid embarrassment. E. Stop the scenario, address the omission, and have the learner repeat the step. C. Document the mistake for end-of-course grading. D. Assign the learner to write a reflective essay. 4. When evaluating a TNCC skills lab, which evaluation method provides the most reliable measure of a participant's trauma assessment competency? A. Peer review feedback forms. B. Multiple choice written test on trauma algorithms. C. Structured objective clinical examination, OSCE checklist. D. End-of-course satisfaction survey. 5. A TNCC course developer wants to ensure compliance with national trauma education standards. Which step is most critical in the curriculum development process? A. Designing unique trauma mnemonics for the course. B. Aligning course objectives with published trauma care guidelines. C. Reducing course length to improve attendance rates. D. Removing advanced skills content to simplify delivery. 6. In mentoring a new TNCC instructor, an experienced educator models how to manage a disruptive participant during a high-fidelity simulation. This best demonstrates which mentoring strategy? A. Directive coaching. B. Role modeling in context. C. Providing written mentorship guidelines. D. Assigning independent learning modules. 7. A hospital's TNCC training audit reveals inconsistent documentation of participant skills testing. Which regulatory compliance action is most appropriate? A. Require all instructors to complete documentation refresher training. E. Allow individual instructors to choose documentation formats. C. Eliminate written documentation for skills tests. D. Delay courses until audit completion. A. During a TNCC course evaluation, a facilitator wants to measure how well learners can prioritize trauma interventions in real time. The most suitable evaluation method is A. Multiple choice exam on trauma sequencing. B. Direct observation of scenario-based simulations. T. Group discussion on intervention priorities. D. Open book written test. 9. Which strategy best supports adult learners with varying levels of trauma nursing experience in the same TNCC class? A. Deliver identical lectures without adjustment. B. Group learners by experience for targeted scenarios. C. Require all participants to take an advanced trauma exam. D. Allow experienced nurses to skip basic skill sessions. 10. A TNCC instructor is revising the skills assessment rubric. To enhance fairness and reliability, the rubric should A. Be subjective to allow instructor discretion. Include detailed, observable, and measurable performance criteria. C. Focus only on theoretical knowledge. D. Allow partial credit for skip steps. 11. In TNCC mentoring, which practice most effectively builds a mentee's confidence in performing rapid trauma assessments? A. Offering general encouragement without critique. B. Providing structured feedback tied to specific performance indicators. C. Allowing mentee to observe without hands-on practice. D. Assigning reading on trauma protocols only. 12. A TNCC course aims to improve interprofessional communication in trauma care. Which simulation element best supports this goal? A. Individual skill stations with no team interaction. B. Multidisciplinary team-based trauma scenarios. C. Written essays on communication theory. D. Instructor-only debriefings. 13. In aligning TNCC course content with adult learning theory, which factor is most essential? A. Providing opportunities for self-directed learning. E. Limiting practice opportunities to preserve supplies. C. Requiring memorization of entire trauma protocols before practice. D. Using only instructor-led lectures. 14. During a TNCC course, a participant expresses frustration at the pace of instruction. The instructor should first ask the participant to adjust expectations. B. Conduct a quick needs assessment to identify specific concerns. C. Ignore the complaint to maintain schedule. D. Assign additional homework to the participant. 15. Which evaluation method would best capture both knowledge and decision-making ability in TNCC participants? A. Written essay on trauma concepts. B. Multiple choice exam only. C. Scenario-based simulation with integrated oral questioning. D. Peer review ratings. 16. A TNCC coordinator is developing a refresher course for nurses with prior certification. To maximize relevance, the course should A. Repeat the standard curriculum in full. B. Focus on updates to trauma guidelines and advanced skills practice. C. Eliminate all lectures to prioritize simulations. D. Assign only self-paced e-learning modules. 17. In a TNCC instructor workshop, using a video of a real trauma resuscitation, followed by guided analysis, primarily supports which adult learning principle? A. Abstract theory learning without context. E. Learning through direct application and reflection. C. Memorization of steps without practice. D. Passive observation without feedback. 18. Which action best ensures that a TNCC program meets ongoing regulatory compliance requirements? A. Conducting an annual review of national trauma education standards. B. Allowing instructors to decide their own assessment methods. C. Relying solely on learner feedback for updates. Avoiding external audits to save resources. 19. When teaching TNCC airway management to visual learners, which instructional strategy is most effective? A. Detailed verbal explanations only. B. Step-by-step demonstration with visual aids and anatomical models. C. Written protocols without images. D. Repetitive oral quizzes. 20. A TNCC preceptor notices that a mentee consistently delays initiating circulation assessment. The most effective mentoring intervention is to A. Assign an article on circulation assessment theory. B. Role-play trauma scenarios with focused feedback on timing. C. Review written protocols only. D. Extend lecture time on circulation assessment. 21. To ensure accurate TNCC skill performance evaluation, an instructor should A. Use a standardized skills checklist validated by the course authority. B. Allow learners to self-assess without instructor observation. C. Use personal judgment without a rubric. D. Test each skill verbally only. Trauma Nursing Core Concepts, TNCC. The Trauma Nursing Core Concepts, TNCC test is a specialized assessment designed to evaluate a nurse's knowledge, clinical judgment, and practical skills in the management of trauma patients. Developed by the Emergency Nurses Association, ENA, it is a core component of the TNCC course, which emphasizes systematic assessment, rapid identification of life-threatening injuries, and evidence-based interventions. The test covers primary and secondary survey techniques, airway and breathing management, shock recognition, head and spinal trauma, and pediatric and geriatric considerations. It also evaluates communication, teamwork, and adherence to trauma care protocols. Passing the TNCC test demonstrates competency in delivering high-quality, standardized trauma nursing care in emergency and critical care environments. Here are the top 5 beneficial uses TNCC exam. 1. Enhances critical trauma skills. Validates and strengthens nurses' ability to perform systematic assessments, identify life-threatening injuries quickly, and initiate evidence-based interventions in emergency situations. 2. Supports standardized trauma care. Promotes consistent application of nationally recognized trauma protocols, improving patient outcomes and ensuring care quality across diverse healthcare settings. 3. Boosts professional credentials. Serves as a respected certification that demonstrates advanced trauma nursing competence, increasing career advancement opportunities and professional credibility. 4. Improves team communication. Trains nurses in structured communication techniques such as SBAR, enhancing coordination during high-pressure trauma scenarios. 5. Ensures regulatory compliance. Helps institutions meet accreditation and continuing education requirements by verifying staff proficiency in trauma care standards.